Hello people, today we will be learning about GIT. In this, the pleomorphic adenoma, which is the benign, gross features are round, well-demarcated masses, encapsulated but capsule is not fully developed. Microscopic features are heterogeneity, epithelial elements and matrix of loose mesenchyme. Epithelial elements are ductal or myoepithelial cells and in form of ducts, acini and tubules and sheaths. Here, the matrix of loose mesenchyme, we are having loose myxoid tissue, conchoid tissue, and rarely bone. Now, mucoepidermoid carcinoma, which is malignant. Gross features are apparently circumscribed, not encapsulated, while the pleomorphic adenoma was encapsulated. Microscopic features are the cords, sheaths, or cysts are lined by mucinous cells as muco, word, epiderm, squamous cells, and third, both squamous features plus mucus-filled vacuoles are detected by mucin stain. So here we can see the mucinous cell, squamous cell, and the hybrid cells. Further, we will start with Baretts Oesophagus, a very important question. It's a complication of chronic GERD. GERD means gastroesophageal reflux disease. Now, characterized by intestinal metaplasia. This word is really important. Intestinal metaplasia hota hai within the esophageal squamous mucosa, because the esophagus is lined by the squamous epithelium while the intestine is lined by the columna with goblet cells are present. Okay. Now, here the squamous epithelium of the esophagus got replaced by this here, the intestinal columnar epithelium with goblet cells. That is the Baretts Oesophagus. Now, so here I have written that squamous epithelium in esophagus got converted into intestinal columnar epithelium, which is acid resistant. This process is called metaplasia. Now, morphology of Baretts Oesophagus, very important. Red velvety mucosa. Red velvety mucosa. Here is red velvety mucosa of Baretts Oesophagus, but the normal squamous epithelium of the esophagus is having pink color. Okay, normally pink color hota hai, but in the Baretts epithelium we are having the red velvety mucosa, presence of goblet cell, especially wine goblet, and that got stained by the HNE staining. Dysplasia, cancer, adenocarcinoma of lower part of esophagus if metaplasia occur for a long time. If there is metaplasia for a long time, the adenocarcinoma, there is risk of adenocarcinoma. Next we will start with the clinical features of Baretts Oesophagus. GERD symptoms like diagnosed by endoscopy and biopsy. Treatment, decrease HCl, which can be done by the proton pump inhibitors, very well known, which is a drug of choice. Prokinetic drugs which stimulate the peristalsis, and surgery, fundoplication. That's all for today's video.